The number your doctor celebrates as a win might be the exact number quietly stealing your balance, your memory, and your independence. I'm not talking about a number that's too high. I'm talking about one that's too low, and nobody warned you. You followed the advice, you took the medication, you did everything right, and yet, dizziness every morning, a mind that feels slower, a body that no longer trusts itself to stand up without holding on. Here is the core problem. After the age of 60, blood pressure is no longer a single number with a single meaning. The guidelines most physicians use were not built with your specific physiology in mind. Today, I want to walk you through what the research actually shows, why the most celebrated targets may be working against you, and the precise framework for finding what a genuinely safe, personalized number looks like. The standard blood pressure classification system, normal, elevated, stage 1, stage 2 hypertension, was built on population-level data. It tells you where your numbers sit on a bell curve. What it cannot tell you is whether your specific physiology will thrive, suffer, or deteriorate at any given reading. After 60, the cardiovascular system changes in ways that make this critically important. Arterial stiffness increases through collagen cross-linking and reduced elastin integrity. The baroreceptors, pressure-sensing nodes in your carotid arteries and aorta, become less sensitive. The feedback loop your body uses to regulate pressure, moment to moment, begins to lag. The result? Blood pressure in an older adult is far more volatile than in a younger person. A systolic reading of 122 in the morning may be 148 by afternoon and drop to 106 when you stand up too quickly after dinner. The single number on your physician's chart, taken once and seated, is capturing only a fraction of a much more complex reality. When I review the literature on blood pressure targets in adults over 60, the first thing I look for is not the headline finding. It is the exclusion criteria, because what the major trials excluded tells you everything about who their conclusions actually apply to. Two landmark trials are cited constantly on this topic, one conducted in the United States in 2015, one in China in 2021. Both compared an intensive blood pressure target of below 120 systolic against a standard target of below 140 in adults aged 60 and older. Both found the same headline. The below 120 group had fewer heart attacks, fewer strokes, fewer cardiovascular deaths. That sounds definitive, and it would be if you stopped reading there. That same group also had significantly higher rates of dizziness, fainting, electrolyte disturbances, and acute kidney injury. They were falling more, and in an older adult, a fall that causes a traumatic brain injury or a hip fracture is often the beginning of a rapid, irreversible functional decline. Now here is what almost never appears in the summary articles. The 2015 American trial excluded anyone with diabetes, anyone with a prior stroke, anyone with dementia, anyone with advanced kidney disease, and anyone with severe frailty. The people most likely to be managing blood pressure in their 60s and 70s, those with diabetes, kidney strain, or a prior cardiovascular event, were largely not represented in the trial that produced the push below 120 recommendation. It was testing that target in strong, cognitively intact, metabolically healthy older adults. And it still produced more falls, more fainting, more kidney stress. For someone who doesn't fit that profile, chasing 120 may carry more risk than the elevated pressure it is meant to treat. Before I continue, if you are the kind of person who wants the real science behind aging and cardiovascular health, not the simplified version, this channel was built for you. Subscribe to Golden Glow Senior and turn on notifications. The next video on this topic goes even deeper, and you will not want to miss it. Now, the practical framework. Here is the framework I rely on after reviewing this body of research extensively. Profile 1. Active, independent, no significant chronic conditions, ages 60 to 79. Walking regularly, cognition sharp, kidney function normal, not on multiple medications, no history of dizziness or falls. A target below 130 systolic over 80 diastolic is appropriate and likely protective. If you can sustain below 125 without any symptoms, the data suggests incremental cardiovascular benefit, but symptom-free is the critical qualifier. Profile 2, ages 60 to 79 with complicating factors. Managing diabetes on 4 or more medications, reduced kidney function, history of dizziness when standing, moderate frailty, or early cognitive changes. A target below 140 systolic over 90 diastolic is not just acceptable, it is likely safer. Pushing lower without careful monitoring introduces the exact risks described in the trial data. Profile 3, age 80 and above. In adults over 80, aggressive blood pressure lowering is associated with increased all-cause mortality in several analyses. A systolic target of 130 to 150 is appropriate for most, calibrated by symptoms. If tolerated below 130 with no side effects, there may be benefit, but the word tolerated carries enormous weight here. How do you know if your pressure is too low for your body? These are the warning signals. Lightheadedness when transitioning from sitting to standing. Morning dizziness, unexplained cognitive fog, unusual fatigue, muscle cramping, and systolic readings that regularly fall below 100. Any one of these is your body communicating that the target has been set too low for your individual physiology. There is one measurement I consider essential for anyone over 60 managing blood pressure, and it is almost never discussed in mainstream content. It is called the orthostatic blood pressure measurement. The process is simple. Measure lying down, stand up, measure again at 1 minute and at 3 minutes. A drop of more than 20 points systolic upon standing is called orthostatic hypotension. It is present in roughly 20 to 30% of adults over 65 and significantly higher among those on antihypertensive medications. Why does it matter? An older adult can have a sitting blood pressure of 128 systolic, perfectly managed on paper, and still be experiencing dangerous underperfusion to the brain every single time they rise from a chair. Orthostatic hypotension is independently associated with falls, fainting, cognitive decline, and cardiovascular events. If your blood pressure management is not accounting for positional changes, you are only seeing a fraction of the picture. Anyone over 60 on blood pressure medication or experiencing any of the warning signals I described should ask their provider for a formal orthostatic assessment. Beyond targets and medications, the underlying vascular biology responds meaningfully to non-pharmacological inputs. 3 mechanisms the research consistently supports. Nitric oxide bioavailability. Nitric oxide is what causes arterial smooth muscle to relax and drives vasodilation. After 60, endothelial nitric oxide synthase activity declines. Dietary nitrates, dark leafy greens, beets, arugula support nitric oxide recycling through the enterosalivary pathway. Moderate aerobic exercise upregulates ENOS expression in the vessel walls. Arterial stiffness reduction. Omega-3 fatty acids, specifically EPA and DHA, have been shown in multiple randomized trials to reduce arterial stiffness as measured by pulse wave velocity. Magnesium in glycinate or malate forms supports smooth muscle relaxation and has been associated with meaningful blood pressure reductions in populations with low dietary magnesium intake. Cortisol and stress hormone regulation. Chronically elevated cortisol drives sodium retention through aldosterone pathways and directly increases vascular resistance. Sleep quality, particularly deep slow-wave sleep, is one of the most underappreciated levers for vascular health and cortisol regulation available to adults over 60. The reason so many older adults feel confused, undertreated, or overtreated around blood pressure is not a failure of medicine. It is a failure of personalization. The guidelines were written for populations. Your body is not a population. If this kind of evidence-based, deeply researched content speaks to you, subscribe to Golden Glow Senior. Every video on this channel is built on the same commitment, reading past the headline and giving you the real picture. Thank you for your time. Take care of your body with the precision and respect it deserves. Because at every age, and especially after 60, the details are everything.